A 56-year-old man with long-standing ulcerative colitis and a dysplasia-associated lesion or mass lesion in case of the rectum. In case of the rectum, admitted with jaundice. On CT scanning, liver has 3 nodules of the right lobe and 1 nodule in the left lobe, and also the CEA, which is the carcinoembryonic antigen, is elevated. What is the most likely diagnosis? Here are the options. Options are yolk sac tumor, hepatocellular carcinoma, metastatic lesion, cholangiocarcinoma, and rhabdomyosarcoma. So what are the answering option of this question? Again, let's see the scenario. 56-year-old, long time suffering from ulcerative colitis, and also we found the dysplasia or mass in the rectum, and in case of the CT scanning there is the lesion or tumor in the liver. So what is the diagnosis? First of all, let's see, this may be due to metastatic lesion from the colonic primary. That means the colon, that means the rectum also part of the colon. So the malignancy from the rectum may be metastasized to the liver. DALM, that means the dysplasia associated mass or lesion, should be excised for oncological colectomy for this reason. This burden of metastasis disease is unlikely to precipitate jaundice directly and nodal disease. So here we can see the carcinoembryonic antigen. It is the another tumor marker, and CEA, it is usually released by the normal colonic epithelium, but its normal range is very less, which is the less than 5. But what happened in case of the carcinoma? In case of the carcinoma, abnormal epithelium present in case of the bowel, and also there is the abnormal epithelium present in the, and they have the higher capacity, so they secrete more carcinoembryonic antigen, and blood level of carcinoma embryonic antigen is increased very high. It may be 15, it may be 20, it may be 30 or more, it may be even 100 or more than 100. So in this condition, that means the carcinoembryonic antigen, it is normally present in case of the bowel epithelium or colonic epithelium, but it is less than 5. But in case of the carcinoma, it is very increased. So the answer is metastatic lesion. Now see why metastatic. First of all, it is long standing ulcerative colitis. So long standing ulcerative colitis, it is predisposed to development of the colon cancer, and finally the colon cancer development, that means DALM, that means the dysplasia associated mass of the lesion. So the lesion present, and it should be malignancy, though there the histopathological presentation not present, or histopathology not present here, but with histology it should be malignancy of the rectum, and present with jaundice, that means liver involvement, and we know that the GIT pathology usually metastasized to the liver. And CT scanning, there is 3 nodule of the left lobe, 1 nodule to the, or 3 nodule to the right lobe, and 1 nodule to the left lobe. That means there is the definitive metastasis. What happened in case of the colon malignancy or in intra-abdominal malignancy? Intra-abdominal malignancy, it first metastasized to the liver. Why? Let's see a figure here. Suppose this is a human, this part is the thorax and lower part is the abdomen, and here liver present, and liver receives 80% of the blood supply, 80% of the blood supply from the intestine by the portal system. Here we can see the portal system, and the portal system, it is formed by the portal vein, it is formed by the splenic vein, and also the superior mesenteric vein. And the splenic vein and superior mesenteric vein, they drained all of the blood, almost all of the blood from the abdomen, and finally they drain into the liver. That means the cancer cell who is from the colon or who is from the intra-abdominal organ, it first goes to the liver and first metastasis occurs in the liver. So in case of the abdominal malignancy, the first portion, that means the first one, it should go to the liver, and the malignancy other than the abdomen, it usually goes first in the lungs, because bypass the liver, they first go to the heart and then the lungs. For this condition, as it is the abdominal malignancy, that means the rectal carcinoma. So in case of the rectal carcinoma, first metastasis to the liver. And here we can see the feature of the liver compromisation. So it is the metastatic lesion of the liver and primarily cause in the of the rectal carcinoma. Thank you all.